I would like now to start with the third day of our Regions for Health Network Marathon. With other words, to talk today about climate change, environment and health, and to look forward to learn from your experiences and get further scientific advice. So now I repeat again, good morning, good afternoon, good evening. Today, at our third day, we are discussing what can Regions for Health do to increase societal resilience and to mitigate, in terms of CO2 reductions, climate change. A few days ago, the Lancet Countdown highlighted again and reconfirmed what had been said for decades, but with much higher level of evidence, really small, to ensure that we are not getting up to the 4-degree in some years to come. And as the Secretary General today said, we need to do all effort in the world, everybody of us, to keep our world not higher than the 1.5 degrees Celsius. With this, I would like to now hand over to the two co-chairs, for which I'm extremely grateful. Vladimir Kandrovsky, our technical officer from the Bonn Office on Climate Change, who is replacing Dr. Oliver Schmoll, who unfortunately has been breaking his leg, and we wish him all the best for a speedy recovery, and Professor Evgeny Gasho, for co-chairing the session. I would suggest Dr. Professor Vladimir, would you take the chairmanship?
Yes, with pleasure.
Oh, okay. And then we hand over also to Professor Gasho for saying a few opening words.
Thank you, Bettina. So, distinguished colleagues, of course, with great pleasure, I'll welcome you to day 3 of the Regions for Health meeting. And I wish to thank all of you for joining this meeting despite the unusual circumstances in our collective pandemic experience. As Bettina mentioned, I'm Vladimir Kandrovsky. My background is medical doctor and specialist in environment, health and hygiene, and I'm technical officer on climate change and health within the WHO European Center for Environment and Health in Bonn, in Germany. And today, all our focus will be to achieve the main objectives of our session on climate change, environment and health. And they are to understand the impact of climate change and environmental condition on human health at subnational levels. The second one is to equip regions with the means to take climate change action in the integrated manner. Last but not the least is definitely to understand the role that the subnational level can have on the achievement of COP26 goals and expected result of the negotiations. With this, I would like to hand over the floor to Dr. Gasho Evgeny to introduce himself. Dr. Gasho, the floor.
Сердечно благодарю госпожу.
Thank you very much indeed. My warm thanks to Bettina and to Vladimir for the opportunity to participate in such an important event. I am professor of Moscow Energy University, and I'm actually the biggest pollutant of the environment present here today, and I have an important impact on the environment. At the same time, I represent an industry that brings all of us heat and warmth. Thanks to this industry, we can gather, we can communicate, we can smile to each each other at a distance of several thousands of kilometers. So thank you very much for organizing this important event. We are going to try to make sense of different efforts that we can take at the level of different regions. Moscow has basically finalized the energy transition, and it is ready to share its experience with other cities and with other regions. It is particularly important in the context of the challenges set by the climate change. And I would like our colleagues to have the opportunity today to exchange views, and I'd like to introduce our first speaker. It's Dr. Joseph Anto. He will speak about the main risks and impacts of the global environmental crisis on human health. You have the floor.
Thank you very much, Mr. Chairman. It's a great honor and a big pleasure to participate in this session. So thank you very much to Bettina Mene and Vladimir Kendrowski and the other organizers of the session for giving me the opportunity to share with you this session. I will now share my presentation. I hope you can see it the right way, full screen. Is that okay? Yes?
Yes.
Perfect. So, as I was saying, I'm Josep Maria Anto, Professor of Medicine at the Pompeu Fabra University and former Scientific Director of Global Health Institute in Barcelona. And I've been invited to talk to you about the main risks and impacts of the global environmental crisis and the human health. And let me begin with the context that was already well described at the initiation of this session. And the context, obviously, is the climate crisis, is the Anthropocene, and it's also the consequences of the COVID-19 pandemic that we are living with. Well, the concept of the Anthropocene that is overarching for the crisis that we are dealing with is relatively new. It was this is an image of the Science paper in 2016 with a group of geologists and other earth scientists suggesting that the humanity has entered in a new epoch, and that this new geological epoch is characterized by the negative impacts of the human activity on the natural systems of the Earth. And as you know, the main negative impacts are obviously the climate warming by greenhouse gas emissions, CO2 and others, and also the accelerated loss of life species that characterize the loss of biodiversity. But obviously, there are many other negative environmental impacts, mainly the microplastic contamination that is becoming ubiquitous, the distortion of the soil and phosphor nitrogen in land, that it's probably the biggest impact in millions of years, or the permanent layer of iron particles in our atmosphere all over the planet. But one main characteristic that was alluded in the inauguration of this session of this context is the urgency. And the urgency is because the growing scientific evidence that these negative impacts have tipping points, and that these tipping points mean that beyond certain thresholds and planetary limits, we will have negative effects in cascade that are irreversible, hard to predict, and impossible to manage. And this was stressed in the IPCC report called 1.5 degrees urgent. All the world and society and United Nations to do all possible efforts to keep global warming below 1.5, not exceeding 2 degrees, something that is unfortunately more and more seeming hard to reach. Well, this concept of overall crisis and urgency has a fundamental consequence, and the consequence is in this picture of the Global Environmental Outlook report. It was released 2019, and in this picture of the geophysics, what it tells us is that business as usual in the blue line, we will keep losing sustainability at an unacceptable rate. with traditional environmental policies, the ones that we have been putting in place in the last decades, in the red line, we can slow the pace of losing sustainability, but not at the time that we need. It will be too late for the kind of impacts and tipping points that we are dealing with. So we need the green line, and the green line basically is transformative changes at large scale in record time. Well, you can see that the theme of the GEO6 was healthy planet, healthy people. And this leads me to a change of paradigm in the concept of health, which is what I call the planetary health concept. In this report in the Lancet 2015 is a very well known for all you. The authors suggested that we have a great problem with our current concept of health, and this problem is the problem of externalities. Is because we don't take into account whether the health gains that we are achieving are at the cost of eroding the earth underpinning natural systems. And then they came with a definition of planetary health, saying it's the achievement of the highest attainable standard of health, well-being, and equity worldwide through the judicious attention to the human systems, because these systems shape the Earth's natural system limits within humanity can flourish. So it's a complex definition, but it's a very good definition. But I suggest you can put in a very simple terms, just saying human health and the health of the planet should go together now and for the future. Well, this concept of planetary health is not new. It's very similar to the concept of One Health and the concept of eco-health that have started in different frameworks. So these concepts, planetary health, One Health, eco-health, are different converging frameworks that are being developed in different disciplinary contexts, but the key concept is pretty similar. Well, this is my way of translating this concept of planetary health in a more simple description of what can we do. This is a 2x2 table. This is the preferred tool for epidemiologists when we are dealing with a complex problem at the initial step. And then you have here one side the human health and the other side the health of the planet. And very simply, 4 categories: the things that are good and good for us and the planet, the things that are bad and bad for us and the planet, and the trade-offs, the things that may be bad for us and good for the planet, and the other way around. And you can see that are examples in all different categories. The more difficult one is to see what is bad for us that is good for the planet, which is interestingly even epistemologically interested. Probably COVID can be one example. But for the sake of time, I will focus my attention on the things that are good and good. And this is related to the concept of co-benefits and the mitigation co-benefits. And then 2 big examples are sustainable mitigation policies and sustainable cities and sustainable food systems. So in the next slide, you have a recent paper. It was published in the Lancet by Ian Hamilton and others, and it's a study doing modeling. And what they are modeling is different sectors like transport, food production, energy in different countries. This is in 9 countries, some of the largest emitters in the world. And then what they model is 2 scenarios. One is the sustainable pathway scenario. The other is enriched with health for all policies scenario. The SPS is consistent with Paris Agreement and the SDGs, and the other one is supplemented with health for all policies. And what you can see is that in these 9 countries, just for the travel, active travel scenario, due to the co-benefits on air pollution, diet, and physical inactivity, you can have millions of deaths prevented. 1.2 for air pollution, 5.8 for diet, 1.15 for physical activity. If you add health for all policies, you increment with additional 500,000 for air pollution and diet, and about 2 million for physical inactivity. Well, this is a good example that these mitigation policies are good for human health and good for the planet, and this is the way to go forward. Well, this is national data. It's much more difficult to have data at the city level, but it's very important because cities are increasingly leading the changes, the transformative changes that we need. And here you have an example of a recent study. It was published in the Lancet Planetary Health a month ago by
Уважаемый Joseph, 1 minute, sorry.
I'm sorry, you have 1 minute left.
telling us is that with changes in green spaces, adopting the WHO, we can save 43,000 preventable deaths in 768 cities in Europe. Again, a very good example. Let me just tell that there is similar example for food sustainable diets, still room for improving our food guidelines to make them sustainable for the planet. You have a large agenda of changes and strategies in this Lancet paper and in the ERA research goals that has been launched by the European Union, and you have the link. There is an open consultation for you to participate if you are interested. And then let me finish with the overarching concept of equity. We have robust evidence that the more vulnerable are the ones that are poor or suffer inequalities, and that addressing these inequalities and these inequities is fundamental for achieving the SDGs and achieving health gains in the context of the impacts of the Anthropocene. With this I finish, and I thank you very much for your attention.
Большое спасибо.
Thank you very much indeed, Professor. Now I would like to give the floor to Professor Maria Nilsson from Umeå University, Sweden. She will speak about the impact of climate change on human health. And I'd like to draw your attention, colleagues, to our timeline of 10 minutes per presentation. We have to stick to it. Thank you. You have the floor.
Thank you so much for inviting me as well. I'm really happy to be here on your meeting. I am a professor in public health, but I also have the orientation of climate change and health in my professorship. And I also am the chair of the Lancet Countdown in Europe, a newly started initiative. Climate change threatens to undermine the past 50 years of gains in global health. Global public health. It clearly shows adverse impacts on health, which are projected to worsen with further temperature rise in the coming decades. And no country is immune to this. On this slide, you find an overview of the rather complex links between greenhouse gas emissions, climate change, and health, and how the resultant climate change poses a range of threats to human health and survival in multiple interacting ways. Impacts can be direct, for example, heat waves and extreme weather events such as storm, forest fire, flood, or drought, as you can see in the center of this slide, or indirectly mediated through the effect of climate change on ecosystems. And that is, for example, agricultural losses and changing patterns of disease, and through also effects of economies and social structure. And here we could include migration and conflict. Citizens across Europe and beyond face increasing extremes of heat, threats to food and water systems, and changing patterns of infectious disease as a result of climate change. During my presentation, I will focus on the increasing temperatures to start with. And heat-related mortality had increased by 33% in the WHO European region in 2018 compared to the year 2000. Due to Europe's aging populations, urbanization, and high prevalence of chronic health diseases, European populations are globally the most vulnerable to heat. On this slide, you see the observed annual mean temperature trends across Europe between 1960 and 2019, and the projected future changes under different emission scenarios. An RCP, a representative concentration pathway, is a greenhouse gas concentration trajectory adopted by the IPCC. RCP 4.5 is described by the IPCC as an intermediate scenario, and RCP 8.5 as a business as usual scenario, where emissions continue to rise throughout the century. Since the end of the 19th century, long-term warming trends can be observed across the globe. And in the left panel on this slide, the black dots represent such significant long-term trends. And in the middle right panel, you see projected changes in land temperature under the two different scenarios by 2071 and 2100 compared to 1971 and 2000. By the end of the 21st century, data projects that European land temperatures will increase further by 1.4 to 4.2 degrees Celsius under the intermediate emission scenario, and by 2.7 and 6.2 Celsius degrees under the highest emission scenario. In recent decades, the European region has experienced an exceptional number of pronounced heat waves, negatively impacting health, economies, and well-being. Exposure to extreme heat can lead to adverse health outcomes with increased mortality and morbidity from heat stroke, heat exhaustion, and heat stress, and from exacerbations of respiratory and cardiovascular diseases and kidney problems. High temperatures are also associated with negative impacts on emotional and psychological health, increased interpersonal and group violence, and congenital and birth complications. So what about the future then? Well, this slide shows extreme heat waves projected under the two different climate forcing scenarios in Europe. And the map shows the median heat wave projected in the near future from 2020 to 2052, and in the second half of the 21st century from 2068 to 2100, under the RCP 4.5 intermediate scenario at the top, and 8.5 business as usual scenario at the bottom. Under the high emission scenario, it is projected that extreme heat waves, similar to or stronger than the 2003 heat wave, which had severe consequences on mortality and morbidity, will occur in Europe every second year in the latter part of this century. Furthermore, a recent study also indicated that all European metropolitan areas, including EU 28+, Moscow, Oslo, and Zurich, will be more vulnerable to extremes of heat in coming decades. Excessive temperatures can also affect the health of workers, which is an important perspective, as well as result in reduced work capacity and labor productivity, with adverse economic, social, and health consequences. According to the 2020 Lancet Countdown report, 1.2 billion potential working hours were lost in association with high temperatures across Europe in 2019. Workers in all sectors are impacted, but those occupations involving a higher physical effort or those that take place outside are impacted the most. European agricultural workers see the highest absolute reduction in labor capacity compared with workers in service, manufacturing, and construction. A number of infectious diseases are also affected by climate variation, including waterborne and foodborne diseases, and diseases transmitted by arthropod vectors such as mosquitoes or ticks. Weather can influence the intensity and temperature pattern of arthropod vector activity, including by modifying feeding and biting rates, altering their survival, reproduction and development, as well as being affecting the survival and reproduction of the pathogen within the vector. A couple of examples. Dengue, which is a major global public health problem, is the most rapidly spreading mosquito-borne disease with high levels of incidence in tropical and subtropical regions. But changing rainfall patterns and rising temperatures due to climate change are consistently increasing the environmental suitability for dengue transmissions also in Europe.
2 more minutes, Maria, please.
Yes, with current trends, it is projected that dengue will be established in southern Europe within 50 years, with potential outbreaks in the north. Water and foodborne Vibrio bacterial infections can also result in gastrointestinal, ear and wound infections and severe sepsis, which can be fatal. And these pathogens grow in warm, brackish water, and climate change-driven alterations in seawater temperatures and salinity alter the abundance, distribution, and patterns of infection. And regionally, elevated levels of Vibrio have been observed during hot summer season in the Baltic and the North Sea, and is increasing, and also doubling the length of the highest risk seasons. Because of the short time I have today, I've focused on some selected health impacts. And now, soon ending the presentation, some health impacts related to climate change also that I really want to point out are the undernutrition, mental health problems, cardiovascular and respiratory disease, allergy and trauma. And I just also want to mention the Lancet Countdown in Europe, which is recently established transdisciplinary research collaboration to monitor progress on health and climate change in Europe. With a wealth of data and academic expertise available in the region, the collaboration will develop region-specific indicators to address the main challenges and opportunities of Europe's response to climate change for health. And those indicators produced will provide information to assist health and climate policy decision-making. And to just conclude, I would like to cite Dr. Tedros. And as he said, the risks posed by climate change could dwarf those of any single disease. Every fraction of a degree hotter endangers our health and future. Similarly, every action taken to limit emissions brings us closer to a healthier and safer future. Thank you very much.
Thanks, Maria. There will be an opportunity also for answering the questions. And I would like to remind all participants to send your questions for your open floor discussion through the chat function. And with this, I would like to introduce Dr. Revati Palke, the head of Climate Change and Health Group in Public Health England. And Dr. Palke will be speaking to us about the European Zero Regret policy and action. Dr. Palke, the floor is yours. Thank you.
Thank you very much, Vladimir, and I hope to share my screen in a way that you see it. Good. Is this full screen for you now?
It's fine. It's fine. We see it.
Fabulous. So, hello everybody. As Vladimir said, thank you for the invitation for being part of this this program. So, I'm head of the Climate Change and Health Unit in UK Health Security Agency, and I also chair a newly established Health Systems Global Thematic Working Group on Climate Resilient and Sustainable Health Systems. And I'm going to talk to you a little bit about what we have done so far in terms of the Zero Regrets paper together with the WHO region, but also how can we prioritize health action towards as all the speakers before me have outlined, scaling up both the ambition that we have, but also the action that we have at the ground level to reduce the health impacts on those most vulnerable. So as Maria has outlined and also Professor Anto outlined, the window of opportunity for us is very, very narrow. It hasn't completely closed yet. And even half a degree of rise from 1.5 to 2 will have devastating effects on health and societal development. And it will affect our ability to support the local living environments that enable health and well-being as outlined in the ambition of the Regions for the RNH network.
Sorry, Revati, the slides are not full screen. They're in presenter mode. Could you change to be in full screen?
I did do that, but probably it's not working. Okay, is this better? Is this better?
Yes.
Okay, fabulous. So I think the first message from a policy perspective is, of course, to keep the ambition alive for 1.5 still as we go into the negotiations for COP26. We shouldn't abandon the goal of keeping 1.5 within vision at least. Yesterday, a report was released by the UNFCCC assessing the NDCs received from, I think, 164 countries' submissions. And based on the assessment, they are estimating that to limit the warming to 1.5 degrees, we need emissions to drop by over 45% by 2030. And what we are observing is that the dangerous trends that we are seeing, we might end up with an emission rise by 2030, and that will, of course, negate the 1.5 ambition that we have collectively agreed to at Paris. So, of course, echoing the voices of the previous speakers, there is a need for and of course, a call not just from the health professionals, but also overall the environment and the climate colleagues from both academic, policy, and practice side for urgent, scalable action on climate change and health. And within the Zero Regrets paper, we have outlined a 5-step approach from moving really in understanding risks, but also moving in the direction of resilience. So societal resilience at the national level, but more importantly at the subnational level, because that's where most of the adaptation action happens, and that's where most of the adaptation evidence needs to be generated that can then be fed back into how policy is conceptualized and implemented at the national level, but also at the regional level. So the first step obviously would be to revisit the impact pathways that have been conceptualized by the RHN and try to drip feed the concepts of climate change. It is happening. I won't go into the details of the points that have been highlighted in the impact horoma, but obviously there are clear opportunities and quick wins within these actions to scale up our ambition for gearing up collective and coherent action across programs and policies for climate mitigation and adaptation. I will very quickly outline some of the action areas that we have recommended in the Zero Regrets paper, and I will begin with saying that the main message we would like to propagate from not just from the COP perspective, but also from the overall discussions is there is a strong need for aligning the ambitions for the Agenda 2030. So, of course, efforts are in place from the programmatic perspective to align the metrics and the progress monitoring and the frameworks and the operationalization of resilience, whether at the community level, whether within the health systems or in dealing with individual health outcomes of climate change. But there's definitely a need to develop and to sustain alliances across the different ambitions that have been set at the global level, at the WHO European level, and then of course at the national level, because majority of the financial decisions, but also actions for implementation, will be led by national and subnational teams. And I'm sure on yesterday, a lot of speakers have highlighted the importance of also using the opportunity of recovery from COVID-19 to incorporate and further strengthen the voice of integrated and coherent action for infectious diseases and climate change as well. Of course, understanding risks is always the first step, and a lot of work has gone into developing models of assessment, and Maria outlined quite well how the health impacts are being monitored currently, but these are also done at the national level. But what we probably should be focusing more, and this has come out from a recent study on heat and health as well. Given the inequalities, we do need that subnational level of the finer resolution assessments of how individual communities are affected by individual exposures, but also how the same vulnerable populations are repeatedly exposed to multiple hazards. So having that all hazards approach, improving the analytical capability, but also supporting it with data systems and consistently over a long period of time. It's not that we are asking for more data, but what we are saying is that we need to systematically approach it so that the methods, as well as what data is available to us, is usable for local decision making using all hazards approach rather than looking at single exposures and single outcome measures, which is of course important from the methods development point of view, but not necessarily from the health protection point of view. And of course, this needs to be done iteratively. So having subnational assessments at a baseline is key, but then also updating them, not just for the greenhouse gas emission for individual health systems, but also from how the other vulnerabilities are evolving over time. And of course, this has to be followed by looking at the economic benefits, like how Professor Anto outlined, that climate change and health is an economic argument. And the longer we wait to act on it, the higher will be the cost, not just in terms of the burdens from the health, but also from the resources required for scaling up action and to match the level of adaptation that will be required, given that there are also limits to adaptation. And mitigation is, of course, the mainstay and the first point for looking at health and climate change. Health
Please, Revati.
2 minutes or 1 minute, Vladimir? 1. I'll end. So, of course, the health sector plays a very key role in mitigation. So there is this tension between scaling up health services for maintaining universal access for healthcare, but also we are responsible for over 5% of the greenhouse gas emissions. So one thing is to keep our ambitions down, emissions down, and raise the ambition for simultaneous action on mitigation and adaptation. And of course, we will see at COP26 how countries have included health in their nationally determined contributions, the national adaptation programs, if there are health maps, and of course the adaptation communications, which will decide the ambitions of countries for adaptation. I'll end with 2 other messages that, of course, moving from understanding risks to resilience also means that we have to prioritize equity, put it front and central of all the recovery, but also the climate action, and look at institutionalizing the capacity of understanding the risks, but also responding to it. And operationalizing resilience within systems, whether it's health systems or wash systems or food systems, is an incredibly difficult thing to do. And we need to start conceptualizing this at subnational level, where RHN plays a very important role. And I will end with saying that for any action, you obviously need a very strong monitoring network, which shows the evidence and builds the evidence over time. Mutual learning. So obviously the regional climate profiles that the RHN has developed is an opportunity to update them for climate aspirations at the subnational level, and having case studies which can demonstrate what works where and build that evidence as we go along. And not to forget that none of this can be achieved without financing. We know that yesterday there was an assessment that the goal of achieving 100 billion by 2020 will not be reached until 2023. So raising that ambition for financial flows where they are needed for both research and operationalizing action is necessary. Thank you very much.
Many thanks, Revati. Now I'd like to introduce Sonia Roshnik from Healthcare Without Harm, who will be speaking to us about what can healthcare institutions do for climate change and the environment. So Roshnik, the floor is yours. Please.
Thank you very much, and thank you to Bettina Mene and everybody that's organizing this important conference. So my role today is really to tell you what healthcare systems can do. You've heard a lot about the risks of inaction, and we've also heard from Revati that the healthcare systems contribute 4.4% of the global emissions. So that's, if you thought that as a country, it would be a number 5 country in the world. So that is a significant amount, and the healthcare sector has got a real role to play in reducing those, not just for its own self, but also as a catalyst to wider societal transformations. So I'm going to try and describe some of that to you now. But the background really is that if we do not take action, the emissions from the healthcare sector will treble by 2050. And that is because of increasing diseases, changes in demographics, in population. And so business as usual is just absolutely not feasible. And it means that the health sector is going to have to work even harder to reduce emissions. Now, the good news is that by, as has been described before, that by mitigating climate change, we can actually build resilience, reduce equity issues, and improve health. So there's no reason not to take urgent action now. So some of the things that a health system can do is really to engage the staff and the board to set an ambitious target. At the moment, we've got a lot of healthcare institutions around the world that have joined Race to Zero. In fact, 53 have, that's covering around 11,000 hospitals, and they've all committed to net zero by 2050 and 50% reductions by 2030. We want as many people to join the race as possible, and of course, we need to make sure that everybody reaches the end if we want to be in a livable world. The other thing that's happening in advance of COP and at COP is that we're working with WHO and with the UK government to seek country commitments around resilience and decarbonisation. And we think there will be a number of countries that will sign up to both and really start making definite plans to setting a baseline at national level and to identifying what their roadmap to net zero might look like. Now, all organizations can move to renewable energy. It's one of the the changes that can happen all around, which can reduce air pollution, reduce emissions, and improve resilience in areas where maybe it's harder to access electricity. Buildings can be built with low carbon cement, with reusable steel. They can be positioned in places where to reduce solar gain, to facilitate access. There are so many different aspects that are under the way we develop buildings. But we can also make sure that we move towards zero carbon transport. Some of that is about encouraging active travel wherever possible, and also to more sustainable food choices. All of these things that I'm describing, if the health sector can start moving towards them, will actually highlight that society can do the same. Health professionals are some of the most trusted in the world, and if they start advocating for these changes and demonstrating them through the way their institutions are run, we will be catalyzing action through society at a wider level. Now, some of the aspects that maybe people are less familiar with is to do with medicines. So the carbon footprint of a healthcare sector is, over 20% of it relates to medicines and drugs that are used, and yet there are ways in which we could reduce that. One good example is inhalers, where the gas that is used to propel the drug, the pst, is a very highly potent gas, and there are other forms of propellants that can be utilized to make sure that the drug reaches the lungs as required, and without having a specifically adverse clinical effect. So that kind of transition and transformation would need to happen across a number of different drug choices and the way drugs are prescribed. For instance, for mental health, we can prescribe active exercise, access to greener spaces, which are preferable and better for health than anti-anxiety tablets. We've seen through COVID that the amount of stuff that we utilize in healthcare is enormous, and it has increased because we were not so well prepared with a pandemic in the use of all of our protective equipment. And yet, if we could design some of our protective equipment and other products that we utilize, design them for reuse and manage the waste in a different way, we could reduce the emissions and reduce the waste and save money in that utilization. So moving to what we would call a circular healthcare approach could bring a lot of dividends. And in fact, nearly as much as moving to renewable energy, because we would be reducing the plastics that are utilized. And the last one that I'd like to highlight is that we need to seriously think about the model of care, how we deliver our services, so that we are focused on prevention, on building resilience, supporting mental health, and supporting vulnerable communities in their own homes. We've learned through COVID that knowing who your vulnerable people are and how you can support them best is a key building block. And we know that adopting a very high intense medical model is very high in carbon emissions, and not necessarily the best way of reaching high health outcomes for your population. So we do need to transform the way we deliver healthcare and use that as an approach to start transforming the way a country runs its business, the way society runs itself, so that we have a chance to be lower than 1.5 degrees. I know Bettina posted in the chat, how are we going to do this? Well, the only way is to decarbonize aggressively now and continuously, so that we can reach a 50% reduction by 2030. So I would call on you all not to wait until we've aligned policies for 2030, but to start using 2021 as the first year to set commitments, establish a baseline, and develop action plans. There are a lot of no regret or win-win measures that can be taken. So as next week we're going into COP, we've got 46 million health professionals who've signed a healthy prescription letter. We've got these 11,500 hospitals and more, and a lot of the healthcare industry and drug companies who've signed up to Race to Zero. And we think there'll be a significant number of countries who will have signed commitments to Race to Zero as well. So I hope that with you all, 2022 will be the year for acting, the year for reducing carbon emissions, because we do know what we need to do. It's just that we need to get on and do it now. So I'll finish there, and thank you very much.
Many thanks, Sonia. Yes, very nice call. And I sincerely hope that the regions will take it seriously and join you in this call. I would like now to invite Emmanuel Pinot, Director of City Diplomacy, C40 Climate Leadership Group, to take the floor and inform about the activity of this group. Emmanuel, the floor is yours. Thank you.
Thank you very much, and thank you to the City of Moscow and the World Health Organization for this invitation. For those who don't know C40, we are a network of 97 cities working to tackle climate change, both reducing emissions and building resilience. And the City of Moscow is one of our members and is quite active in a number of projects. I think when it comes to the topic we are discussing today, climate change and health, it's an angle of climate action that mayors of the C40 network have been particularly sensitive to for a very long time, because the question of air quality particularly is a very deep concern of politicians at the local level and a big concern of population. And a lot of mayors who are taking ambitious action on climate change to reduce emissions in their cities because they understood the urgency to do so, have been framing this action a lot in relation with the necessity to improve air quality. And as a matter of fact, at the urban level, effectively the solutions to fight climate change and improve the quality of the air in the city are quite similar. We're talking about reducing carbon emissions in the cities, mainly and most directly through the decarbonization of transport. So a number of those cities who are in the C40 network and also beyond the network are engaged into electrifying public transport in their cities. providing options for citizens to move in the city without using cars and with using more decarbonized and active ways of moving, of transporting themselves, such as cycling and walking in the city. And of course, working with the industry and the national governments to provide the infrastructure for all the other vehicles in the city to be electrified, cars, trucks, etc. So there's a strong work that is happening now in a number of cities around the world to decarbonize transport. And this is clearly both for climate concerns and human health concerns and the question of air quality. Now, in the last year, obviously, with the outbreak of the COVID-19 pandemic, the question of climate change and health in cities has taken a complete different angle and tone. And the mayors who are involved in the C4D network have taken very seriously, obviously, the management of the health crisis and the sanitary crisis. They've often been at the front line of managing the response. And they have organized their cities to make it safe places for people. They've also been in charge of very often to ensure that lockdowns were respected, etc. But very quickly, they also start thinking of the post-COVID city and in terms of recovery from the crisis and how we can use this shock, this tremendous shock that the world is living, to turn it into a kind of opportunity for change. The profound change we need to do to tackle climate change. I think several of the previous speakers have mentioned that the urgency of taking immediate and transformative radical actions to reduce emissions in cities. So the COVID-19 recovery and the policies, and particularly the stimulus that national governments and also regional organizations such as the European Union, for example, have decided, have planned to distribute and are distributing at the moment to a number of countries to tackle, to answer to the sanitary crisis, are a huge opportunity to make the right investments for climate change action, for climate action and for climate mitigation and adaptation in particular. So the mayors have been very aware of this and have been calling quite clearly for their national government to invest COVID-19 recovery funding into a green and just recovery. That is a recovery that doesn't put the world again on the 3-degree scenarios, that isn't investing highly in fossil fuels and high carbon infrastructure, but on the contrary, a world that invests in clean energy, that decarbonizes the energy system, decarbonizes the urban system, the buildings and the transport system to tackle climate change. And not only the mayors are making this call to the national governments, but they're also taking direct action in their cities to start creating this decarbonized world that they are calling for. I already mentioned the decarbonization of transport, but there are also other policies and experiments that are happening in cities to make this happen. For example, to improve the health of well-being of citizens, creating 15-minute cities, so very thriving and compact neighborhood where all services are accessible to all citizens in a short walk, giving streets back to the people. Build with nature is another key element of this city action for the post-COVID city. All of this, I think, with a very strong concern for the mayors, both for climate and health, but also for climate and equity, and with a very strong view on reducing not only emissions, but also reducing inequalities in the cities. So this is a full agenda for green and just recovery that C40 mayors have created in 2020, and that has been from last year and still is one of the main driver of city climate action at the moment. Thank you very much.
Большое спасибо, доктор Эммануэль. Сейчас я хотел бы передать...
Thank you very much, Emmanuel, and now I'd like to give the floor to Moscow representative Dr. Evgenia Simutnikova, Deputy Head of the Department of Nature Management and Environmental Protection of the City of Moscow. She will speak about the Moscow strategy aimed at reducing the risks to health explained by environmental and climatic factors. You have the floor. Good afternoon, dear friends. I'm happy to welcome the moderators, the presenters, and the audience of this session. All the presentations before mine were dedicated to a clear link between health and climate change, and as well as pollution and environmental factors. And of course, we take this as an evidence-based fact, and we are using that when determining the priorities of our city development. My presentation is a very specific one. It is dedicated to what's being done in Moscow, but I would like you to listen to it through the prism of the measures that have already proven their effectiveness, and these measures can be effective when implementing them on any territory. It may be European Union, it may be post-Soviet space, it may be a small town or a big city, or a region where there is a mix of different cities and towns. So there are three pillars that should be taken into account by all the territories, even if they are very different. First of all, it is of course the ambient air quality and the environmental quality. Second of all, it is accessibility of green spaces and the possibility to practice sports on nature, and everything related to physical activities.
I'm in charge of the Moscow Environmental Department, and I do focus on the factors in this field that are a priority, and about 25% of the contribution to the welfare of the people inhabiting this territory have to do with three major areas that I have just listed. This is the first basic presentation on Moscow as the newest member of the network. So I will just enumerate the projects thanks to which Moscow, in terms of the environment, was able to achieve significant and confirmed results. And when you have questions, I will be happy to dive into a bit more detail on all the points that I make. 10 years ago, 14 state programs for the development of Moscow were approved, and they focused on several points. Moscow is a comfortable city, Moscow is a healthy city, and a number of other points that confirm this thought. 7 out of the 14 state programs today contain events or projects, as a rule, with mid-term implementation frameworks that have impacts related to positively improving the environmental footprint or the climate situation. For instance, the urban setting development, developing urban spaces, developing sports and cycling, developing pedestrian solutions and parking solutions, and pedestrian proximity from places where people live in concentrated residential areas. Green construction reduction, reorganization of industrial spaces, eclectic management of resources with creating parks, a residential program. One of the KPIs for this program that we're monitoring is the energy efficiency of the newly constructed housing. A key driver in the environment is our program to reform the transportation infrastructure of Moscow with a key focus on developing comfortable electronic transport, the utility program, where we are renewing all of the key networks, and thus we're able to reduce losses. We're able to monitor consumption of various resources more accurately. The economic development program and boosting the investment appeal. As part of this activity, for the first time, Moscow has issued green bonds for an amount of almost $1 billion, developing the environmental transportation network and a whole number of other programs. If we could please move on to the next slide.
Программы, связанные с развитием велосипедного и
Programs that have to do with the development of cycling and pedestrian areas and spaces. I can give you some numbers. Over the last few years, less than a decade, we've created almost 300 cycling lanes. If we're talking about dedicated lanes, it's about 900 kilometers in total, and this enabled a whole set of comfortable solutions, working with cycling infrastructure, convenient economic usage formats, significantly boosted the activity of cyclists. We had masterclasses 3 weeks ago with the World Health Organization. And we were looking at how to use the widely accepted methodology, which is now used by all of the cities that are members of the network. Next slide, please. If we could please go on to the next slide. The previous slide, that one? Yes, the slide on Moscow. This one, please. Is there any correlation between the environmental efficiency of the policies and the size of the territory? Well, there was a whole number of indices, well respected, that have ranked cities, indicated that usually we have Copenhagen as one of the leaders, Stockholm, cities whose greenness has already been acknowledged in terms of the population, in terms of the area. They're much smaller than Moscow. Moscow is 2,500 square kilometers, 12.5 million inhabitants, without taking into account those that commute to Moscow for work.
В Москве, несмотря на это, доказана экологическая эффективность,
In Moscow, we have proved the environmental efficiency. Unlike other cities, Moscow made the decision to continue its economic potential and industrial potential. 10 years ago, all of the industrial plants approved their climatic and environmental upgrade programs, and in all of the territories, and there's always a lot of residential areas which are close to transportation areas, close to infrastructure areas. We're reducing the environmental footprint via implementing these upgrade programs as part of the new federal legislature, new federal projects, as well as part of the state programs for the city of Moscow. Let's please go on to the next slide. Transport, it's a driver of climate and environmental effectiveness for Moscow. Traffic jams is a problem that we've been faced with, as all of the other big cities. And as I mentioned, there is a correlation between the size of the city and its environmental efficiency that has been proved. For the cities to overcome this key issue, serious state programs and investments are needed, and they can offset this complexity that comes with the size of the territory. In Moscow, we have expanded the network of transport to reduce traffic jams. Among the key initiatives I would like to outline, as I said, I have to stick to the key ones because I have to rush through it. There is this goal in terms of how to make public transport more comfortable and how to make e-transport more comfortable. More specifically, Moscow, as part of the transport infrastructure development program, is placing an important focus on developing the Moscow metro, the subway. There are dozens of new lines that have been launched and will be launched in the midterm. As you know, 3 years ago, Moscow declared that it's going to develop its public e-transportation, adding new e-buses, and the fleet of e-buses is over 800 buses as of today, and every year we'll be adding 300 more, so this fleet is going to expand. Next slide, please. Not this one. If you could please go down. You went up. Please go down. One of the speakers mentioned some of the important numbers that it's important to confirm the environmental KPIs that we're setting. Moscow introduced a monitoring system and its technical upgrades is an ongoing effort. Everything that can be measured automatically is being monitored online in real-time mode, and people have access to this information. The list of the substances for which we are measuring the efficiency is much wider using lab methods, and it's important to highlight here because this is the network of the World Health Organization. I have to say that the Moscow system was initially set up to properly calculate the exposition of the population, and this sets very specific requirements to the location of the station, to the understanding of which zones, what kind of population, where they spend their time, the list of harmful substances, constant updates in terms of the impact that substances have and the change in their impact. And this is one of the complex challenges for monitoring system for big cities. Let's please go on to the next slide. We can miss the slide. I went over it, the important points, so we'll miss some of the slides. Another important point that I wanted to dwell on, despite the fact that Moscow is an industrial city with a big environmental potential and a huge population, it's a metropolis that's going to maintain its position as one of the leading metropolises in the world. It's unique. Moscow is unique in the sense that it was able to preserve nature, not newly created green areas, but nature as it was. So we have forests, we have areas about 250 square kilometers as a total green area. Half of it would be newly created green spaces, but 34% are the specially protected natural territories which are protected. Next slide, please. These are unique city forests. I wanted to share some images. Nobody would be able to guess that this is a huge city that we're talking about. Biodiversity, there are over 500 different types of trees and animals inhabiting Moscow. There are, in Selebrny Bor, we have falcons. We have one that lives on the building of the Moscow State University. There are various programs to support. We have sables, for instance, all of the animals that have made it into the Red Book. They are being monitored. The numbers of the populations are being monitored and preserved. Next slide, please. Let me just mention that the city is working on preserving its natural territories, but they cannot be turned into reservations. So the inhabitants have the right to use them as recreational areas, and for each natural area, the inhabitants have the chance to practice 22 types of sports activities, both in winter and in the summer. And over the recent years, a whole infrastructure was set up to support this opportunity, going back to mobile activity, physical activity, and that's also been a key priority. Let's go on to the next slide, please. There are some natural territories that are preserved, and Moscow is a big city, is also setting itself the goal to maintain a balance. Trees can be cut down in Moscow, but there's a law that talks about mandatory offsetting and compensation. If for residential construction trees are being cut, they need to be replanted 1 to 1. 1 to 2 if you cannot do that in the nearing areas. These are the compensatory trees, and this is set by the progressive norms of the Moscow legislation. This is part of the project engaging the population as much as possible, a new project called Our Tree. This is a project for families. When people have a newborn, people start a family, they can plant a tree before the child reaches the age of 3, and then every year the amount of people that want to use the service is growing. Over the last 3 years, almost 50,000 requests have been satisfied coming from people. They're very interesting solutions. People can even choose the tree that fits the character of their kid. I can't give you all the details. Bettina's watching me, looking at me. I can feel that, and I'll just rush through the remaining slides. We're looking at efficiently managing the Green Fund of Moscow. The goal there is to ensure maximum biomass of trees that can exist in urban spaces with limited land. Next slide, land management, 17,000 hectares is the territory of the city, currently being reorganized or restored, where there were landfills previously and inefficiently used in terms of the density. They've been reorganized. At least 10% is going to be allocated to green territories. Next slide, please. Let's skip this one. Just 1 minute, please. Moscow is a member of C40, and I would like to use this opportunity, just 60 more seconds. Emmanuel, I would like to thank you so much for effective interaction between the cities, exchanging our experience. This is an opportunity for us to disclose our greenhouse emissions. Another slide on the climate, and and I'll wrap up after that. So next slide, please. Next one, the climatic plan. Moscow, over the last 25 years, reduced its carbon emissions by 25%, 22 million tons. That's an astonishing number in absolute volumes, and this is a quarter, a third versus the total emissions of carbon in Moscow. We're currently developing a climatic plan. This is also as part of the organization C40 requirements, an action plan. And in December, we are hoping to present this plan for approval to the mayor of Moscow, Sergei Sobyanin. The next slide, please. The last one, the very last one, last slide. As part of our effective environmental policies and environmental accomplishments, it's no wonder that we became part of the Regions for Health network, and I would like to wrap up what I started off with. All of our initiatives need to be beneficial for the health and welfare. We need to be able to monitor and quantify them properly and scientifically confirm them. And for this opportunity, I would like to thank the network for the methodology that it provides, and on our turn, everything that's done in Moscow and applicable to other territories, we're willing to share, communicate, and be open. Thank you so much. I couldn't interrupt you.
Thank you very much for the presentation.
Such a detailed account. Thank you so much, Vladimir. We share the same name, so I couldn't interrupt. Okay, we're going to go on to the Q&A session, and together with Vladimir, we're going to try to read out some of the questions that our colleagues received. Vladimir, I'm going to start, if you don't mind. A question to Arto. What measures will be taken to prevent the ecosystem pollution? Joseph, please.
Question, Mr. Chairman, but I could not get the question. It was.
What measures will be taken to prevent ecosystem pollution?
Vladimir can translate it to me to English. I'm very sorry.
The question is regarding the type of measures needs to be implemented for the mitigation. This is the question.
Okay. 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 Well, I think that there is a clear understanding that there are many different type of actions for mitigation that can be implemented, and we have seen with the Moscow City very nice example of many different mitigation activities that can be implemented. So every time we have people moving from car transportation in cities to active transportation, either walking and cycling, we are reducing emissions and we are improving health and decreasing mortality. So I think that there is plenty of actions that can be taken. The evidence, the scientific evidence supporting these actions is very well established. The feasibility is established. There is growing experience in scaling these actions across countries and cities. And I think that the major turning point for transformative changes is the political will and political feasibility. Even the cost, I mean, it's well established. So it's the money is there, and there is evidence that in many cases the economic benefits of the health outcomes are so important that can compensate the cost of the mitigation policies.
Спасибо. Thank you. Спасибо. Thank you.
Thank you.
Еще, Владимир, ваш вопрос.
Vladimir, you had a question?
Let
me just read out the question. A question to Maria Nilsson. The level of emissions of carbon emissions into the atmosphere, how would you explain that? What is the reason for this level of carbon emissions in the atmosphere? Professor Nilsson?
Well, we can see that carbon dioxide is added to the atmosphere naturally, of course. For example, when volcanoes erupt, when we have organisms that respire. But when we talk about the problematic carbon dioxide, we should also talk about what we add through human activities. And such are the burning of fossil fuels and also the production of cement. So what we have done as humans has actually contributed to the problem we have today with those high levels of carbon emissions.
Thank you. Спасибо. Вопрос профессору Falke.
A question to Professor Falke. If we all know that emissions are harmful, then why earlier we did not take adequate measures to resolve the issue?
Yeah, I would refrain from saying that no adequate actions have been taken previously. Actions are in place. However, the speed at which the emissions are rising does not match the action that is taken. And then the second thing is also that how do the emissions kind of match to our understanding of risks and what can we do about it? I think that also needs to be reconsidered in the light of saying this. That's probably, yeah, I wouldn't say that whether the efforts that are in place currently are enough and what more needs to be done is a question, and it's a very valid question. But yeah, I would refrain from saying that no action has been taken previously.
Спасибо. Thank you.
Thank you. And a question to Professor Pinot. Vladimir, apologies, you wanted to say something?
No, I just want, if Evgeny agree, I can take from now to ask some questions. Also, I prepared some of them, in particular for Sonia Roshnik, because you already mentioned something about the commitment and the action that we need to act now. But can you explain what type the skills in favor of such a remarkable net zero commitments and what specific measure a plan to achieve this? Probably you can share some of example from UK, some regions, whatever. Thank you.
Yeah, so why, I guess, I think the question is, why is it that we've achieved such a level of ambition just in this last year, and what might be some of the examples? And I think that the COVID pandemic has highlighted how vulnerable we are and how connected we are to our own personal health. So suddenly people have become much more conscious that actually, you know, if we do not look after the environment, we're going to be in much worse situation. The pandemic was a health crisis, but the climate crisis is also a health crisis that is much larger. So I think there's been a raised awareness. The other thing that's happened is that the NHS, where I used to work before, has committed to net zero and developed a very detailed plan about how you can get there. The question that they answered was, how fast can you get to net zero in a national health system? And they published that plan over a year ago now. You know, was built on a decade of work that had been done, looking at the NHS and the wider health system footprint in the UK, and really working to reduce the carbon footprint. And so already over 30% had been reduced, and people understood that it was possible to take steps to reduce it further. So through good measurement, you can actually identify where the hot spots are, where are the big areas that can be reduced. And that's why we developed the roadmap for decarbonisation. It was to highlight the potential of all the interventions that we know already. And that potential can help enormously and can get us quite close to zero, but we'll still need to seek further innovation and change some of our practices in order to get there. So is that enough of an answer? I think we're at a tipping point where people realize that if the health sector does not take this on and actually reduce emissions significantly itself, it's failing in its core mission of delivering health to the population. So, you know, that's become a very real message for everybody. And I, as a healthcare professional, when I realize that patients around the world, including myself, I expect the health sector to do everything they can to be as sustainable as possible, to be there in crises whenever we need them. Well, it's a huge responsibility that we have on our shoulders to do something about it. And I think that has become very real, and COVID has actually brought it into a stronger perspective.
Thank you. Спасибо, Sonia.
Thank you, Sonia. Vladimir, I will take the floor back and I'll ask a question. I want to ask a question to Evgenia. In Moscow, active measures to mitigate emissions are being taken, but what's going to happen to the Moscow region? Perhaps it's the situation there is not as favorable. Are you going to have a plan for reducing the level of emissions in the Moscow region and adding greener areas? Well, the Moscow region is an independent subject of the Russian Federation, and I would refrain from commenting their programs inaccurately, but I can go by what I know. The Moscow region does have state programs, and they have indicated actual improvements in the environmental situation. All the points I've made, that all the territories are in different situations. Moscow is a huge city. We don't have woodlands. We have a very high density of residential construction. The Moscow region is an area that has a serious recreation potential with a lot of woods, with a lot of water, and there is a program to preserve this and the biodiversity of the region. I can say that 18 months ago, we made a joint decision together with the Moscow region on setting up a single environmental monitoring system. And today, well, 2 months ago, we launched 15 stations. In the same logic as the Moscow system, it's a joint solution, it's a joint decision of the leadership of the Moscow and the Moscow region administration. And we're also working on the fuel initiative. The Moscow region supported Moscow in this initiative, and they have similar solutions in terms of requirements for the quality of fuel for cars as we have in Moscow. I could, well, if the author is interested in a deeper answer, I could readdress it to my colleagues from the Moscow region, and at our sessions, we would be able to present more detailed information on the climatic initiatives and environmental initiatives in the Moscow region. Thank you so much. Vladimir, did you have any more questions?
Yeah, it's one more question I have for Emmanuel, because she mentioned that it's a question regarding the joint action towards the pandemic and climate change. Do you have any estimation or prioritization of the action to tackle the both serious global crisis, or do you have any estimation what you will prioritize after the ending of the COVID-19 pandemic?
Thank you. I think there are two questions in your question. So first, I will answer to the prioritization after the pandemic. It's always the same for mayors engaged in tackling climate change. It's really accelerating the transformation in the cities to achieve, in the long term, carbon neutrality by 2050, or other called net zero by 2050. But to get there, we absolutely need a global halving of emissions by 2030. So reduce global emissions by 2050 by 50% by 2030 is the goal set by the IPCC in their 1.5 special report. And this is the goal that ambitious mayors have set to themselves. And this requires, as I was mentioning before, immediate and very concrete actions taken now. I think it was Sonia who was saying our goal shouldn't be 2030 but 2021. We fully agree with that. At the end of the decade of action, we will have achieved this halving of emissions in 2030. But for this to happen, action needs to be taken now, and it's already happening in cities at the city level. So that is the absolute priority. And as I was saying, COVID has created a context that has, in some aspects, allowed to accelerate some of these actions and provided a moment of dialogue and reflection, collective reflection on how we're going to use the stimulus and all the national policies that are being shaped at the moment to answer to COVID-19 and to the economic crisis as a way to accelerate the decarbonization by 2030. So that is the first question. I think your first question was about the impact of cities, of city action in terms of recovery. C40 has produced some interesting research on the potentialities of green and just recovery in the last years. I invite you to have a look on our website, and I can share the links after this conference. In general, there is a very interesting potential on, obviously, decarbonizing and taking the actions that the mayors have taken around decarbonizing transport, decarbonizing building, building 15-minute cities, as I was mentioning, building with nature. All of this, if this is scaled up to the 97 cities of the C40 network and to all cities of above 1,000 inhabitants, has a huge potential, obviously, to reduce emissions, so to tackle climate change, but also to improve dramatically air quality and prevent hundreds of thousands of deaths every year in cities of the world. And we've also studied the impact on job creation, the economic impact of these transformations. And it's quite impressive. We've just released, actually we're releasing today a report on the green jobs created in C40 cities
through the green transition. And the calculations in terms of jobs are really impressive. We're talking about 1 million jobs that will be created only in the US and Italy through actions to decarbonize the economy, and an additional 148,000 jobs in Italy only to adapt to climate change. So really, Joseph was speaking at the beginning of the co-benefits of climate action, and we have, I think, discussed very extensively the health co-benefits of climate action, but let's have in mind that there are much broader co-benefits also, economic ones, for example, and on job creation that are already documented and just need decision makers to take the decision to be acted upon.
Many thanks, Emmanuel, and many thanks to all speakers. I sincerely hope they're all enjoying the session, and I did so. And now we'll have 10 minutes break before splitting up into our 3 parallel work streams. You already have received a link to the work streams. So I will just, as a reminder, there will be 3 sessions, 3 different work streams. One is on food safety, agriculture, and One Health. It will be moderated by Mr. Peter Bežnec. The second one is on extreme weather event. I will be the moderator. And the third one is on climate change action, where Dr. Bettina Mene and Alice Forcellini will moderate this session. So I invite you first for a health break, and then use, please, your special links to these sessions. See you later.
Vladimir, can I add one plea, please? As we tested it yesterday, please reuse the same link you had for the plenary. This is the most important information to get back after the group work. Okay? That's number one. Number two, I also would like to ask you a little bit in the work streams. There are 2 splendid examples here, C40 successes and the NHS initiative, and then later taken over by the 11,000 hospitals, Healthcare Without Harm, etc., in terms of showing results. It would be very interesting. What are the driving factors for these institutions, cities, regions, whatever it is, hospitals, to lead by example? Thanks very much.